Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the SafeCamp Audio Network. Check out our show page and all of SafeCamp's other great episodes at safecampaudio.org on the web, at SafeCamp Audio on social media. It is a headlines edition week. Usually I wrap those up with some Imprint recommendations, but I'm actually going to start and end with those today because we have a ton of great stuff out. And these first ones I thought were all worth highlighting together because I think it speaks a little bit to the ways in which the rapid pace of actions by the Trump administration early on here in his second term are starting to trickle into states and providers. So 3 stories to check out on that front. And as always, I know I repeat this ad nauseum, but check out our show notes in the Imprint podcast page for links to these stories, or just subscribe to the Imprint's weekly newsletter and you'll get them long before I talk about them here. But here's just 3 stories kind of a piece to me. First one is from reporter Stephen Yoder reporting on the administration's decision to defund the National Prison Rape Elimination Act Resource Center, which manages audits and PREA compliance. PREA stands for Prison Rape Elimination Act, in both juvenile and adult lockups. At least one key Department of Justice program for juvenile facilities, which is called the Targeted Implementation Planning and Support Program, has completely disappeared from the PREA Resources Center's website altogether. An archive snapshot of the webpage described that as providing grants to youth facilities and youth prisons to create sexually safer environments. So Yoder has a criminologist named Hayden Smith out of the University of South Carolina who's quoted in the story, basically saying that these moves by the Department of Justice when it comes to PREA sort of express the view that, and I'm quoting here from Smith in the story, people working in the prison system know best, and we're trimming the fat, and these external sources that we're paying for aren't bringing much to the table. And Smith follows by saying, every bit of research that I've done to this topic counters that. Inmates, frontline staff, and administrators desperately want these organizations to come in. So this is, like I said, we're starting to see how folks who are kind of focused on the front lines of doing things like making youth and adult facilities safer are reacting or feeling the effect of canceled grants that were there to provide, assistance to those facilities and to systems. Second story, Michael Fitzgerald's reporting on the restoration of millions of dollars in funds for the National Court-Appointed Special Advocates and Guardians ad litem program. It's based in Seattle and also kind of in Atlanta a bit, which is largely funded by federal dollars and had their grants canceled in April at the same time that a ton of other groups who are funded out of the Department of Justice also had their grants canceled. It was a surprise to me at the time, frankly, because the internal statement on those grant cancellations out of Justice that was those leaked, I think first to Reuters and then we reported on it, said the purpose of the cancellations was to remove grants that didn't align with the administration's priorities. And then they literally in the same memo listed examples of the priorities that they had. And one of them was protecting children. However you feel about the presence of CASA in court cases, that is their stated goal, is to assist in a child protection system, right? So the funding appears to have been restored in August. So we've got April when it was canceled, August when it was restored. And in between, CASA National issued a 26-page internal guidance changing its training curriculum. I'm going to read from Fitzgerald's story about how some of the changes that were involved there. It instructs training facilitators for court-appointed special advocates and guardians ad litem to no longer discuss inequalities and prejudice in law, healthcare, education, and the welfare system, sports, and entertainment as risk factors for child abuse and neglect. Another change eliminates a line asking volunteers about their understanding of the root causes of disproportionate representation of children of color in the child welfare system and the disparate outcomes children of color experience. Trainers were also told to no longer mention disproportionality statistics or that ethnic and cultural background influences an individual's attitudes, beliefs, values, and behaviors. Similarly, language was stricken, stating, no cultural group is homogenous. Within every group, there is great diversity. So there is probably no explicit communique that spells out, coming from Justice to Costa, that changing the training was necessary to get their funds back. And I don't think it was a straight line as that anyway. The Justice Department said that their reasoning, which they commented on in a statement, was that after a thorough review, the federal government had determined the award activities do align sufficiently with the department's priorities, including protecting American children. But I'm going to go out on a limb and say CASA would not have changed its training process for no reason. And this action had given it a substantial existential reason to change it, right? The grant cancellations had given this very large reason to change it. Millions of reasons, no pun intended. How is that for pressure from above, So then the final story in this trio was Sarah Tiano reporting on Washington state legislature's decision to cut a program called Graduation Success, which is a program run by the nonprofit Treehouse. It's shown real promise in helping youth in foster care graduate high school on time, which is something that Washington and many other states struggle with. So, state budget decision, right? What does that have to do with Capitol Hill and the White House and the Trump actions? I'm going to read you a part of Tiano's story here that kind of jumped out to me and sort of explains why. In a statement, Governor Bob Ferguson explained the broader reductions as necessary given the times. He said Washington chose to cut spending rather than dip into cash reserves, so the state is in a better position to weather massive federal cuts to social services and threats from the Trump administration to withhold funding from states over political disagreements. Ferguson signed the 25 to 27 biennial budget in late May. So what you've got in late May, months before the big, beautiful bill even became law, this is a state governor and legislature doing things like axing a well-regarded program at a key partner on child welfare services, just in anticipation of what might be happening with the federal piece of the pie when it comes to social safety net spending, which really affirms to me that while we've been paying close attention to and reporting on the happenings in DC, next year, the space to watch is really going to be these state legislative budget sessions. The fiscal year is ending at the end of the month. We are not going to have an annual budget by then, right? They have barely started work on appropriations for this year, which means it's either going to be a continuing resolution at the end of this month or a government shutdown. So very likely that when it comes time in early 2026 for states to be setting up spending, it's going to be a huge ball of who the heck knows at a time when the midterm elections will be looming. And then you add to that, we will be fully out of the era of these COVID boosted money that kind of came out, both under Trump and then, especially under the Biden administration. I doubt there will be any real substantial boost to funds from the COVID emergency that are around anymore by the beginning of next year. Last time you saw something like this happen that I recall was in 2012, 2013 era. This was after the Great Recession by several years. But the thing to remember about that is the Recovery Act pumped a lot of assistance money into states. And so it was around 2013 that states started to see that recovery money kind of wind itself out of the supply chain of dollars, if you will. And you saw a lot of states making big cuts into youth and family stuff right around then, or trying to figure out new ways to pay for that through their own funds or through different federal streams. And so all that stuff has consequences and is definitely going to be something to look at. Last note on federal stuff. Last time we did headlines, I think I mentioned that we were getting very close to the end of fiscal 2025, as we were just talking about. And the Office of Juvenile Justice and Delinquency Prevention had yet to even put up notices of its 2025 grants for competition. That is still pretty much the state of play. They did put up one notice of funding availability. I wouldn't say it counts as competitive because there's only one entity that's eligible for it. That's for $6 million. And I think the way that it's written, the only people who could qualify is the National Center for Missing and Exploited Children. Anyway, the lack of notices of funding availability has caused a lot of concern, that this might be a play to kind of slow kill Office of Juvenile Justice funding by the Justice Department getting to the end of the year and then sort of saying, oh, well, sending it back to the Treasury because they didn't have time to or get around to putting it out. The Justice Department, in a statement to us, says, no, that is not the case. The funds that were appropriated for fiscal 2025, and I'm quoting from them here, are available for obligation in fiscal 2026 as well, end quote. OJJDP spokesperson Tanner Watkins told us that the department is going to, quote, make awards on a rolling basis, some of which will be awarded after September 30th. So basically what they're saying there is their reading of their authorization is that the money for this year, which is about to end, is authorized through 2026. So they have the full next year to compete that out if they want. So I guess I will take their word for that on that. Does kind of create an interesting scenario where, let's say, they're starting to really get in earnest, get that money out in competition this fall and are making awards maybe, let's say, right around the holidays or right after that. You're putting all this 2025 money out. You probably have to turn right around and start putting the 2026 money out, if that even exists, because we're just in no man's land. We don't really know what's going to happen with 2026 appropriations yet. It's all fairly confusing. All right, two other things of late that I found interesting, and we'll include links on where to find these in the show notes. The first is some original research from our friends over at Child Welfare Wonk, which is led by Zach Laris. You heard him on this podcast a few months ago talking about Medicaid's role in child welfare. childwelfarewonk.com to check them out. Subscribe, where you can get the email version every week. And they're starting to roll out some premium content as well for paid subscribers. Anyway, they used federal data to contrast the rate at which youth in foster care with a diagnosed mental health condition were getting a combination of mental health medications like psychotropics or antipsychotic medications and treatment, meaning therapy. They were comparing that to the rate for youth in the general population. And what they found was that foster youth get the combination of drugs and therapy at a far, far higher rate. Nearly half, or 49%, of foster care children with a mental health diagnosis receive both prescription meds and therapy. That is substantially higher than non-foster care children in the study at 31%. Then looking at it the other way, how many kids in both subsets receive prescription medication only? Children who are not in foster care were far more likely to only receive prescription medication, 30% versus 12% for kids in foster care. Big disclaimer that they note is that quantity is not quality. I'm going to quote from the study here. It would be a mistake to confuse access with adequacy. What these data can't tell us is if these services were high quality, tailored to children's needs, and effective. But I do think, given our recent reporting that found a lot of states still have a spotty record when it comes to monitoring psychotropic medication use in foster care, which, by the way, that reporting has been nominated for an INN award. It is good news that at least a relatively high rate of these youth are not only getting medicated and are receiving some form of therapy. And my guess is it's actually an understatement that is produced in the Wong study of the gap between foster youth and the general population, because the nature of the way that they came at this, they were looking at household surveys and responses that excluded basically youth who were living in congregate care settings like group homes or one form of that, residential programs, institutions. And, so the question over quality of congregate care aside, those youth, especially the ones in residential or institutions, are very likely to get medication and therapy as well. Another thought this prompted for me was just how the issue of parental relinquishment plays in. As we've been reporting on and continue to do so this year, child behavioral health and parents relinquishing their rights to get kids mental health services through foster care is a real thing. Federal study out this year estimated that between 2017 and 2019, about 5% of all entries into foster care were traced to some form of parental relinquishment. And in some states, it was much higher than that. As far as this study goes, I guess it may not play in a huge deal, honestly, because I'm guessing that a very high rate of youth who are relinquished by their parents in pursuit of services end up directly going into congregate care, and thus would not be kind of covered within the parameters of this study, since it, again, really focused on households. Okay, and then the second thing that kind of jumped out to me recently was the Texas Department of Family and Protective Services posting new dependency code prompted by a recently passed law. And more often than not, a code or regulation is going to clarify what is included. In this case, Texas has updated to specifically state what is to be excluded when it comes to determinations of neglect by the child welfare system. I know some states have clarified generally in law that cases purely stemming from poverty are outside of that space, but this one is quite different and it's quite wide ranging in what it covers. As far as I know, this is the first state to really do this sort of itemized list of what is not neglect. If you know of another state that's got something like this in code, I'd love to know about it. tips@imprintnews.org. Hit us up. I'm just going to go through them because it is kind of an interesting list. Here are the things that are now definitively not neglect in Texas. I've kind of grouped these together. 4 are sort of connected in that they're all about medical needs. Going back to the topic we were just talking about, relinquishing a child to get into foster care to get mental health services, which in this list they describe as refuses to permit the child to remain in or return to the child's home. That is no longer neglect. That refusal to permit the child to remain in or return to the child's home, but specific factors have to be established. Child has to have a severe documented emotional disturbance, and the refusal has to be based on an inability to obtain mental health services that are necessary. And so you really have to, as the parent, basically demonstrate what you did to try and get services before you set out to refuse a child to live at home. You can do another medical one. If a parent or caregiver obtains a second opinion from medical providers or transfers care to another healthcare facility, that can't be held against them. Refusing psychological treatment or psychotropic meds for a child unless the refusal presents a serious danger, including death. And then the other last medical one is it's not neglect if a parent chooses a, quote, recognized alternative healthcare treatment or therapy, end quote, for the child that could be considered as new, emerging, or non-standard, unless that presents a substantial risk of death. Now, that is surely inclusive of many treatments. I'm going to guess that conversion therapy, which is a practice that alleges to change or aims to change a person's sexual orientation, gender identity, or gender expression, is going to be a big point of discussion here, whether that comes up in the context of this new code, whether parents seeking conversion therapy would be something that would be construed to be alternative healthcare treatment within this realm. Then there's the line that I'll describe as the free range position in the Texas code. It's described as it's not neglect if a parent is allowing children to, quote, engage in independent activities that are appropriate and typical for the child's level of maturity, physical condition, developmental abilities, or culture, end quote. And then there's the one that I expect when more people start to notice this change to the Texas code might get some more press. It is not neglect if a parent or caregiver refuses to affirm one or more of the following: a child's perception of the child's gender, including a refusal to use a child's preferred name or pronouns, regardless of whether the child's name has been legally changed, or a child's expressed sexual orientation. I have 2 specific thoughts on this one. The first, and this is something we've discussed on the podcast before, is that this is going to end up, I think, being one more push towards an inevitable need for the Supreme Court to grapple with what it means to affirm or not affirm something as it relates to law. Affirmation, just at its very basic level, is just someone's view of something, how they express that view verbally or in their own thoughts. Actions taken as a result of that view are, of course, very different and far-ranging. This has come up in several lawsuits that are moving through the courts already, related to whether potential foster and adoptive parents can be rejected based on their unwillingness to affirm similar things as what's in the Texas code here. And then the second point, because I think it's important for contextual purposes, it's worth noting that Texas here is codifying a parent's right to not affirm their children's expressed orientation or gender. But in the case of gender, the state has greatly limited a parent's right to affirm those expressions, taking it out of the parental rights arena by making it a crime to let parents consent to or seek out certain gender affirming care for their kids. All right, we'll take a quick break and come back with a few more highlights from recent Imprint coverage.
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the Imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code podcast10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code podcast10 today.
All right, I want to recommend a few more great reads produced by our reporters here at the Imprint. First, from our Georgia reporter, Jordan Anderson, a new legislative body created to study and improve the state's approach to helping youth who age out of foster care is underway. Bipartisan Senate Study Committee on Additional Services and Resources for Transition-Age Youth in Foster Care, that is a mouthful of a name, held a hearing and heard testimony from several young people who have exited the system between 18 and 21 years of age without having been reunified, put with a guardian, or having been adopted. There are more than 650 young adults in extended foster care in Georgia. That is a voluntary program, of course, for 18 and 21-year-olds there. Here's just two examples from Anderson's reporting on the hearing that I think speak to why such a committee is a good idea, albeit, I'll say it, a useless one if they don't act on this stuff. So just two examples of some of the testimony they heard from young people. This is from Reginald Holloway, who had no family connections after 17 years in foster care, had enrolled at the University of West Virginia, but lost his campus housing and had to couch surf with friends to stave off homelessness. Just quoting from his testimony here, a few weeks before my 21st birthday, when I aged out of care, I asked about housing resources. I was advised to look for Section 8 housing. Example 2, Kyra Stout talked about being held back a grade in high school because credits from earlier schools hadn't been properly transferred. From Stout, I was in the 10th grade when I should have been in the 11th. Some teachers recognized, oh yeah, you're way too smart to be taking a 10th grade course. I think one thing that might be smart for this committee, given those examples, would be to hire somebody to just forensically examine federal and state code and just really try to define the universe of things categorically owed or offered to youth who are in this situation, right? Who are set to age out of foster care. And then use a combination of data analysis and qualitative interviewing to go through the list and get a handle on what things are really frequently just missed. Because we know that this is a reality not just for Georgia, but all over the country. I don't know how many studies at this point have really surfaced that youth who are aging out of foster care or who have aged out of foster care express the sentiment that there were things they didn't know and nobody bothered to tell them they were eligible for and that they could have used. Now, is it possible that somebody told them and they didn't hear it, or they weren't ready to hear it, or they forgot it? Yes, of course, but it still speaks to a communication problem, especially with older youth, about all the different things that they may be entitled to. Because what Holloway talks about, we actually have an offer of federal vouchers specifically for what they advised him to go. They told him to go look for public, like Section 8 housing. There's federal vouchers you can use. You don't even need to use them at Section 8 housing, specifically for youth who are in that position. They're aging out at 21. These federal vouchers, FYI vouchers, can be used if somebody knows to help them and connect them to it, to have housing, I think up to like 25 or 26. So those same people could have helped directly pipeline him into a voucher created by former foster youth, by the way, from Ohio, that actually would help with affordable housing anywhere in the state. Stout was held back because of credits not transferring. We spent like 5 years between Fostering Connections Act in 2008 and the Every Student Succeeds Act of 2013, on top of a bunch of other laws, I'm sure, that exist on the state level in Georgia, trying to connect, federal money and state expectations around the continuity of education for youth who are in foster care. So here's hoping, this committee does a serious job. It IDs the major points of failure, and then actually works to fix them. Because if it could actually do that, maybe this is a template for doing this in other states, because God knows Georgia is not the only state where stuff like this is going on. Moving to New York, two interesting things happened as reported by our Sushanti Sarkar. We've reported for a while now at the Imprint and talked about on this podcast the issue of hidden foster care, generally the practice of CPS shifting the physical custody of a kid without a formal removal into foster care. So it's a move of physical custody without the change in legal custody. This often happens in connection with family friends or relatives, less so with foster parents. New York could be on the cusp of taking the hidden out of this, at which point I guess we'll need a new name for it. The language in this bill is alternative living arrangements. More often you hear it called kinship diversion practices. So this bill would require local child welfare agencies. New York is made up of dozens of counties, and those counties really are the kind of strong entity when it comes to social services and child welfare. So these local child welfare agencies would have to track and compile an annual report of any alternative living arrangements for children whose families are investigated by CPS. Along with the physical count of the cases, the report would detail the length of time children are separated from their parents and whether they are eventually returned. It would also include the demographics of impacted families, according to the bill's language. I was reading there from Sushanti's story. And this bill, as is the case with everything in New York, has until December 31st to be delivered to Governor Kathy Hochul for her signature or veto. Quoting from Jabari Brisport, who is one of the lead sponsors on this, "It's time to bring hidden foster care arrangements out of the shadows to ensure that we're doing right by New York's children and that every guardian has the support that they need." New York would join Texas, Georgia, and Washington as states that track these cases on some level. And then Sarkar's second story I wanted to highlight was a settlement reached in a lawsuit called CK v. McDonald's, a federal class action lawsuit filed in 2022 by two private law firms and two prominent advocacy groups, Disability Rights of New York and Children's Rights. At the heart of this lawsuit are promises that New York State made through its Medicaid waiver with the federal government to improve access to and the quality of mental health services in the community for parents and their kids. And what the plaintiffs alleged was basically that the opposite has happened. Scarce community options had led to parents seeking institutional and residential solutions, which had become so sought after, and also in some places still full of youth in foster care or who were juvenile injustice involved, that there were waiting lists for months or even years to get in. So lack of community options leading to people pursuing residential or institutionalization for their kids, and then being in the very tough position of feeling like that's necessary, but still having them on a waiting list. You're just waiting around for months or even a year to get them into the facility you think they need. We did a little 1-hour online forum a couple of years back about this lawsuit, which featured Sandy Santana from Children's Rights talking about it. We had two young people with lived experience in the system in New York to talk a little more about what would be better in terms of community mental health services. So if you want more depth on this, you can check out the show notes. I'll drop a link to that conversation. You can read Sarkar's story for details on the settlement. Beyond the settlement in New York, I do think it's worth pointing out the significance of the win for children's rights, which for decades now was really only focused on litigation related to the quality of conditions in foster care for foster youth. And often it still works in that space. They have several cases ongoing there. As I think we mentioned at the time when this case was brought, it really marked kind of an expansion, sea change of sorts, of the scope of children's rights sort of legal view of what they would pursue to include drivers into foster care as well. And not to go back to the well one more time on this, as we have kind of services and continue to report on, parental relinquishments into foster care driven very frequently by the need to access more or better mental health services has become a real issue in the system. So this is an instance where Children's Rights was certainly landing their litigation upstream of the actual child welfare system. Before we end for today, I want to note, sadly, the passing of Tom Morton, fellow Michigander, who in 1984 founded the Child Welfare Institute and spent his entire career working to improve the child welfare system in America, including a 5-year period where directly he led the Clark County system in Nevada. That's where Vegas and the area beyond Las Vegas is. In addition to his many contributions to the field, Morton penned several op-eds for the Imprint, and sort of behind the scenes, he was one of our most engaged readers. He'd frequently, email me and share his thoughts on something that we did or on something he thought we should do or what was interesting going on in the field. I'm going to link to a few of his op-eds for us. He often wrote those with Jess McDonald, his friend, who was a former head of Illinois' child welfare system. I did want to just kind of close out and read one piece of a 2021 column he wrote for us that I think really explained well his view of what needed correcting in the field. So just permit me a couple paragraphs here. Society continues to maintain a strong attachment to the assumption that both poverty and neglect reflect caregivers' failures to accept personal responsibility. A large segment also believe that poverty and neglect both represent antisocial behavior. These beliefs to many justify the idea that poverty and neglect should be addressed through the authoritative intervention of government to exercise social control over both poor families and neglectful parents. We submit that this belief structure, as it applies to neglect, is based on an antiquated idea of child protection that was rooted in a desire to address serious physical and sexual abuse, which indeed is antisocial behavior. Because this was the focal point, the child protection system was significantly fashioned after the criminal justice system. But the vast majority of neglect and poverty has nothing to do with antisocial behavior. The first response to the majority of child neglect referrals should not be an authoritative one driven by the same cultural assumptions underpinning the criminal justice system, nor should it primarily employ core practices and policies adapted from that system. Unless probable cause exists to support a possible criminal prosecution, or circumstances clearly indicate an imminent threat of serious harm to children in the household necessitating immediate removal, referrals for neglect should first receive a public health response. Morton is survived by his daughter and 3 grandchildren. All right, that is going to do it for us today. Thank you very much for listening. The Imprint Weekly Podcast is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at safecampaudio on all major social media. This podcast is produced and mixed by Christine Onjoko, with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we would love it if you would consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you'd consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is very easy. Just visit imprintnews.org/donate. You can follow the Imprint on Twitter and Facebook by searching the handle @theimprintnews, and you can visit us on the web at imprintnews.org. You can always email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.